they have to do a medical workup on you. So this here, what you're about to see, is what is required of you to do in order to like be considered for transplant. So this stuff is non-negotiable. Like you, if you want to be on, if you want to get on the transplant list, you got to do this stuff. There's this misconception that, you know, if you want to be on the transplant list, you just tell somebody and they just put you on. Like, no, like I've mentioned this before in other videos, but like there's like medical procedures and evaluations that you got to clear. Blood tests, echocardiograms, EKGs, heart stress tests, all that stuff that you got to do before they even consider you for transplant. Because if they find one thing that could cause a complication, they're always looking for reasons to disqualify people, right? They're not actually looking for reasons to like put people on transplant. They're always looking for reasons to disqualify people. So if they find one thing, UNOS or OPTN, if they find one thing wrong with you, they won't even consider putting you on the transplant list. Well, what are they looking for? They're looking for, like, if you have arrhythmia, if you have a heart condition, if you had a history of cancers. One thing that they don't tell you about is your dental work. If you have cavities, they will not clear you to be on the transplant list. If they find out that you have cavities after they put you on the list, they will make you inactive. They have to get like your biometrics. They have to get weight, height, body mass indexed. They have to make sure that you have the space in your body for a transplant. If you're like overweight, if you're a diabetic, all of these things need to be evaluated before they consider you. What's not on here is that they also have to make you go through a psychological evaluation to make sure that they're not giving their kidney to somebody that has psychological issues, possibly depression or mental health issues. So if they give you a kidney and you're just going to commit suicide, well, they just gave the kidney to somebody who just threw it away. They have to make sure that all of this stuff is in order. But like I said, they're always looking for a reason to disqualify you. But this is called a transplant evaluation workup. That's what this is called. So if you are a dialysis patient, right, and you are in a dialysis unit, I would recommend speaking to your social worker, or possibly speaking to your doctor, or possibly speaking to like whoever's in charge of your dialysis unit to see who you have to get in contact with to get, you know, in contact with a transplant, so that way they can give you the workup of what you need to do, so that way you can start working on it. Because the sooner you work on it, the faster they can put you on the transplant list. If you are home hemodialysis, speak to your nurse, speak to your home hemo nurse, who will speak to your social worker and so on and so forth to get you the information that you need to know how to get on the transplant list. Express that you have an interest in transplant and really go for it. Do not let them just sandbag you and blow smoke up your ass and not give you the information. Because that's what a dialysis unit tried to do to me. From there, you give transplant a call, and then they start setting up whatever like testing that you need to do. Some of it's going to be at the dialysis, some of it is going to be at the transplant center itself, and some of it you can do like at your local medical centers. But call and try to find out which ones is which and try to get them done. So as far as transplant goes, OPTN and UNOS, they don't care if you don't get a transplant. So you need to. A closed mouth doesn't get fed. Don't just sit around in your dialysis unit or doing dialysis just looking on the bright side and making the best of it. You need to let these people know what you need. Get involved. Write to UNOS. Write to OPTN. Write to your local dialysis unit. Let them know that transplant's bullshit. And it needs to change.